Hi, so in today's video, I am going to be talking about omega-3. A lot of patients keep asking me, Doctor, should I be taking supplement? What is cod liver oil? What is fish oil? What is the difference? So I'm going to divide it into a few videos. So today I'm going to be talking about what is omega-3. Well, it is a type of fatty acid. It's a type of fat, okay? There are many types. Omega-3 derives its name from its structure. It has got side chains because of which we call them as omega-3 fatty acids. But we don't have to get into the nitty-gritties of it. It is essentially of two types. One is a DHA and another is a EPA. Well, again, I'm not saying the full forms because it is not required to be heard about or just remember the short forms as DHA and EPA. Now, a normal person in her pregnancy requires 200 to 300 milligrams of DHA per day. And where do we get it from? We essentially get it from seafood. So Western countries where, people take a lot of fish or seafood, their omega-3s are kind of done with their diet. But majority of Indian families do not have enough fish in their diet or enough seafood for that matter. Delhi especially has no sea around it. So a lot of people are very wary of consuming fish because we are not sure how fresh it is, whether we should be taking that. There is a risk of mercury ingestion, all that. So essentially, fish is not there as part of our diet. So what do we do? Well, why is it important? So, well, it has been found that these specialized fats are important for baby's brain development and also the retina development, the eyesight, that's very important. So clearly when the baby, it's early on in pregnancy, omega-3s are very important. So you can get it from seafood, you can get it from, especially fish is a good source. But these days we also have the prenatal vitamins, especially folic acid. We add especially the DHA, we call it fortification. Some fancy milks also have DHA, some fancy yogurts also have DHA supplementation. So you could look out for those things from the market and ask for fortified food stuff which are fortified with DHA. Essentially, that is the more common omega-3. But so what should you do if you're not having enough for fish? Those capsules are available. But the bad thing is that they're very expensive. And they sometimes cause a lot of flatulence. You need to bring up a lot of air, they leave a bad taste in the mouth. But the worst thing is that the absorption of omega-3 from most of these capsules of fish liver oil or cod liver oil is very erratic. We don't know how much the body is absorbing. And clearly we can't be doing testing of omega-3s, how much is available in your blood. So these supplements have to be taken, the fish oils especially, you have to read the label very clearly and see how much you are getting from the capsule and the expensive supplement that you are taking. As a doctor, I do not prescribe the fish oil especially because a lot of my patients are not very keen to take those capsules, and also the negative effects. I'm not really convinced that they're really useful. Instead, you should look for prenatal vitamins and food stuff which is fortified with omega-3s. I think essentially, that's about it. I would be bringing up more videos on what specially is contained in cod liver oil and other fish supplements. But if you're buying those omega-3 supplements from the market, please ensure read the label correctly as to you're getting enough of DHA. Like I said, 200 to 300 is what is required per day. I think if you're just taking a good quality prenatal vitamin, that should have DHA supplementation. And that's about it. Watch out this space for more videos on fish consumption and on omega-3 supplementations. We'll talk more. That's all for today. Take care. Bye-bye.